Hi, I'm Dr. Liana, licensed clinical psychologist here at KABC Studios today, talking with Alan Gurvey, host of the show The Doctors Roundtable, speaking about issues related to mental well-being and mental health.
The Doctors Roundtable with Alan Gurvey. And of course, that's me, Alan Gurvey, the managing partner of the law firm of Rowan, Gurvey and Wynn. And today we're talking about psychology and psychiatry. These are two topics that are so important to all of us because it affects all of our lives. Before I talk about our guest, I want to tell a little story about what happened to me probably about 10 or 12 years ago. I was invited to a baptism. It was, I think, my friend's kid's baptism. We were at church, and I sat there. You know, it's one of those things that you don't necessarily want to go to, but you go because it's your friend and you want to make sure that everything goes well and that it's a happy occasion. And we got there, and I was sitting listening to the minister, and the first thing that he said when he started his sermon was, "Life is not fair." And that kind of shocked me. Here we were at this happy occasion, and he said, "Life is not fair." And then he said, "Life is really hard." And for whatever reason that day, I thought about it. Life is not fair. Life is really hard. And it made me feel better. It made me feel like I had just gotten some really important therapy in my life. It had taken some pressure off of me. I have, like everyone else, insecurities and have thoughts of maybe not being as competent as I'd like to be. I think we all have these kind of thoughts from time to time. But listening to that minister saying that life is really hard and life is not fair made me think, well, you know what? Maybe I can do this thing. Maybe I can get through life. But I'll tell you what, it's not always easy. And a lot of people don't realize the role that psychotherapy, that psychology, psychiatric issues play in a happy and healthy life. And it affects everyone. Today we are honored to have on the Doctors Roundtable Dr. Liana Georgoulis. And Dr. Liana has been on our show a number of times. She is the licensed clinical psychologist and founder of Coast Psychological Services, and she is an expert in psychiatric disorders, social anxiety disorders, generalized anxiety disorders, phobias, health anxiety, all kinds of disorders, including depressive disorders, bipolar disorders, stress, and what I'm talking about now, life issues. Dr. Liana, welcome back to the Doctors Roundtable.
Hi, Alan. Thank you for having me today.
It's great to have you, and you are here all by yourself. We are going to roundtable, you and I, because this stuff is just too important. And we don't have other doctors, as you're usually here, with medical conditions that you comment on. But today, we are in your wheelhouse. We are talking about psychology. We are talking about life issues. Tell us, Dr. Liana, why this is so important.
Sure. I'm amazed by the fact that we just don't talk about these concepts and principles of mental and emotional well-being. We walk around in the human body for many, many years, and nobody really talks to us about how to navigate our minds, our emotions, our feelings, our experiences, our behaviors. Why they don't teach this stuff in school, I'm not sure, but my hopes are to help inform people so that they make more informed choices in terms of their well-being.
And you are an expert in this area. Tell us why you believe there is this stigma about talking about our insecurities, talking about our frailties, our flaws. We all have them. I don't care who you are. Why don't we have these dialogues more?
Right. I think there's a lot of things that contribute to that. But if we take a look throughout history, throughout civilization, we've always had people in our communities, in our tribes, in our lives who have played the role of healer or shaman or elder or wise person. And we still need that as human beings. But at some point, the process has become pathologized. So somewhere along the way, we've designated a role as a psychiatrist or a psychologist or a psychotherapist as someone who finds problems with people and then tells them that they have a disorder or an illness. And as we've pathologized the field of psychology or mental health, I think people then begin to think there's a stigma associated with it rather than viewing it as an important role of someone who can maybe give them some insights into what would help them feel better.
And isn't it more important now in this complex world that we live in to address these issues? You talk about historically, you talk about the fact that people always look to the wise folks to understand and to help them with their problems. Our problems are so complex. If we look at the generations that are now becoming young adults, the things that they've grown up with, the complexities of the internet and dealing with social media and all of these issues that we didn't, at least I didn't have as a child, seems to me that what you're saying is dealing with psychotherapy or dealing with the psychology of living is so much more important and so much potentially more debilitating if we don't deal with it.
That's absolutely right. And I think people are afraid. I think we're taught that we're supposed to be strong, that we're supposed to be happy. I think we have all of these myths and misconceptions about what it means to live life and how to live life. And I'm here today to hopefully debunk some of these misconceptions because I think it creates so much more pain and frustration and suffering. And I think people don't often develop the ego strength to be able to take a look at some of their concerns. They view it as threatening, as bad. And I really, really want to normalize the process for people, that it's hard to live life, as you said, and that there's things that we can do and things to know that can make the process more enjoyable, more meaningful, and more worthwhile.
And to be able to accept life as it is, whether you are given a difficult deck of cards or you're not. And most people are, I think, in one way or another, some worse than others. But you have to always keep your eye on the ball and understand that the mind, the way that we deal with things, the emotions, all play a huge role in how successful we are going to be as a human being. And what I want to do later on in the show, so folks, you want to stay tuned, is I want you to give me a little therapy session. I will give you some of my issues, and you go through them with me, helping out and pointing out where a therapist would focus when we talk about specific issues to an individual. That we'll talk about later. But before we do, let's talk about psychotherapy. So tell me why people tend to avoid wanting to deal with psychotherapy, wanting to deal with their problems.
Because I think it creates internal discomfort, and I think it creates disturbance, and I think it also requires us having to have an inner core strength that many people aren't able to develop. And I think that in life, what tends to motivate us is to avoid internal disturbance. So just as you were saying a moment ago, life is challenging. It is challenging. And emotions can be challenging, but we're emotional human beings. Emotions have evolved over time, over thousands of years in human beings, because they're a very important internal navigation system. And when we start dismissing emotions or labeling them as good or bad, then we miss out on some really important information that our psyche or consciousness, if you will, is trying to communicate to us. And when we have these misconceptions that we're always supposed to feel good or that life is supposed to be easy, what we do is we make decisions based on how to avoid internal disturbance. So I might say, this should turn out this way. Why? Well, because that's what makes me feel the most comfortable, right? But that moves us away from living in a truly present, valuable, accepting sort of way. And the more we learn how to navigate these internal disturbances that are absolutely normal and healthy and part of life, the happier we are.
But doesn't all of that start when we're children? right from the beginning when we start having social interactions and when we're dealing with our parents. I know you've talked in the past about parents being psychologically minded. What does that mean, and how can a parent who is listening to this now try to address potential problems that their kids may have in the future?
Yes, so you're absolutely right. These patterns do get established in childhood, and once they're established, they become resistant to change. So this is exactly why people come and see me, because they're not taught this stuff in their childhoods, right? So having a parent who's psychologically minded, what I take that to be is somebody who's done their own work, somebody who knows their own belief systems, their own coping responses, their own attitudes around struggle and life and growth and evolution. And I think when parents come into the parenting role with a better understanding of themselves, they're more able to, they're more effective in their parenting. But many people don't do this work, and they just pass on patterns and they continue what was taught to them in their childhoods.
Isn't it about reactions when you talk about the parents being psychologically minded, being more in tune with life and how to deal with their children? What is it that these parents need to do to not react in negative ways, which creates more negativity with their children, making your job more difficult when you are seeing these children as young adults or adults?
That's absolutely true. So you're going to hear me use the word, being present or mindful or awareness a lot throughout our show today, because I think that's the cornerstone of all work, of all growth, of all change, of all understanding. So it takes a parent who's able to be aware and observe what their internal experience is and know what's coming up for them, and then being able to pause a moment and choose to take action based on what they value and based on the type of parent they want to be, rather than automatically react to the discomfort that they're feeling in that moment, whether that's fear or anger or uncertainty.
That's so important. It's a concept that I hope everyone understands. We have to take a quick break, but when we come back, I want to talk about psychotherapy and what people can expect to get from it. And we're not necessarily talking about people who have been diagnosed with a mental illness or have real profound and dramatic mental issues. Right. We're talking about you and I, everyone who's trying to get through life. You're listening to the Doctors Roundtable right session. I'm Alan Gurvey. This is the Doctors Roundtable right here on Talk Radio 790 KBC. And we are roundtabling it with one doctor, Dr. Liana Georgoulis. Usually we have a whole panel of doctors, but this subject is so important, and Dr. Liana has so much to say that we are giving her the entire hour to discuss psychological issues and how they relate to our everyday life. Dr. Liana Georgoulis is licensed clinical psychologist and founder of Coast Psychological Services. You can find her at drliana.com. That's DOCTORLIANA.com. It's an important website. You go see what she has to say. She covers so many important mental disorders and anxiety disorders. Dr. Liana, before the break, we were talking about psychotherapy. Tell us what types of psychotherapy there is and when someone might want to check it out.
Sure. So, as I explain that, I would like to make the distinction between somebody receiving psychological treatment because they're truly suffering from a psychiatric condition or mental illness versus just normal life stuff, right? So seeing a psychotherapist does not mean that you have a mental illness or that you are crazy.
Right.
It means that you're a human being and that people don't teach you how to navigate this stuff, and that there's somebody who can help you learn how to do that.
So what type of psychotherapy would someone like that really want to focus on if we're just talking about everyday problems and we all need help or at least someone to talk to about?
Sure. So I think there's a couple of things for people to consider. And if somebody truly is suffering with a condition, something like obsessive compulsive disorder, post-traumatic stress disorder, bipolar disorder, autism, schizophrenia, some of those things that we think of when we think of a true psychiatric condition, that person is going to want to make sure that they're working with a specialist who implements treatment interventions that have some research base to them and have been proven to be effective in the research literature. But to answer your question, just about normal human being life stuff, whether it's self-esteem or stress or lack of fulfillment, I think one of the most important things for someone to know is that they want to work with somebody who can really help them understand what it is that they're experiencing and what's getting in the way of them living life in a manner that's most fulfilling to them.
Let me ask you something. When you say that, there are so many obstacles in really understanding who we are. When I deal with lawyers all the time and doctors all the time, a lot of them, to me anyway, don't realize that they are being narcissistic or they're being arrogant or they are being selfish or they're being selfless. Whatever it is, they don't see it. How are we supposed to see it in ourselves when we haven't had the benefit of psychotherapy?
Right. So ideally in therapy, we create a safe room and a safe place where a person feels like it's absolutely okay for them to be themselves and who they are. We want to make sure that our clients don't feel judged in any way, that they feel a sense of being positively thought of. And the person really needs to feel like they have a rapport with the person that they're working with. If there's no rapport, if you don't like your therapist, if you don't feel a connection with them, it's going to be harder to open up.
Isn't it difficult, though, as a therapist to establish that rapport when someone comes into your office, maybe for the first time, and you say something to them that may strike a chord or something that may be really sensitive in their lives, and they take that as, I don't like this person, I'm not going to continue with therapy, versus, oh, maybe I really need to work harder on this. You talked in the first segment about behavior that avoids dealing with your real problems or the real issues. How do you deal with that as a therapist?
Yeah, well, I think the good news is that by the time most people come to see me, they expect that they're going to be getting some genuine feedback about themselves. So I'd say the vast majority of people are open to that feedback. And of course, I always try and convey that in a way that's very genuine and respectful and kind and warm, not in a judgmental, critical kind of way.
Right.
And I think most people get that, right? Sometimes I have to ask for people's permission. I'll say, there's some patterns I'm seeing, there's some things that I think are getting in the way, and I would like to be able to give you that feedback. Are you open to it? Most of the time people will say, well, yeah, that's why I'm paying you.
Right.
Right? But there are those instances where people have a really difficult time taking that feedback, and that in and of itself is very telling. That conveys information to me about what that person might be struggling with. And if that's the case, then we absolutely work on that in therapy, and we talk about why that's hard to hear and what their beliefs are around that and what their fears are.
So what type of therapists are there? What would you consider yourself in terms of a therapist? What other people do you know who may have different approaches? What should someone be mindful of when they're trying to select a therapist?
Yeah, it can be confusing for the consumer because there's a lot of clinicians out there who are part of the mental health world, and there's a lot of different terms. So you have what I am, a licensed clinical psychologist, but there's also social workers, there's also marriage and family therapists, there's also psychiatrists, there's also counselors, there's school psychologists. Right. So basically, a psychologist has a doctorate in psychology and has at least a minimum of 6 years of graduate work post receiving their bachelor degree. So a psychologist is trained to do psychotherapy, but also wears a number of different hats and other roles. So they go beyond just psychotherapy. But for me as a psychologist, my primary focus is psychotherapy. Psychiatrists are medical doctors. They're physicians who have gone to medical school rather than graduate school, and their primary focus is on medication, treating issues pharmacologically. And then we have marriage and family therapists and social workers who are master's levels who also provide psychotherapy. So there's varying levels of degrees and education and experiences.
All right. Well, that's a very diplomatic answer. But for me, I want to know what's good for me. Do I need a psychiatrist, for instance? Mm-hmm. When would I need a psychiatrist? Is he or she better than a psychologist? What about a family counselor or a therapist, a social worker? What I have people coming to me in my practice and they say, why am I seeing this person versus another person?
Sure. So I think if the person knows that they have a true psychiatric disorder, like we talked about post-traumatic stress disorder, bipolar disorder.
And that's diagnosed. You're talking about something that's
diagnosed. Or they're pretty clear they think that might be what's going on, and it's pretty severe, and it's really severely impacting their lives. They might want to start with a psychiatrist so that they can get stabilized on medication first. But if we're talking about life issues, mild depression, anxiety, self-esteem, job stress, relationship patterns, you probably would want to start with a psychologist or a psychotherapist, a marriage and family therapist. They do very similar things. A psychologist just has a bit more education and training.
What about group therapy? We hear that some people offer group therapy. In fact, do you have a social anxiety exposure group?
I do.
And tell us about that, because some people I think love group therapy. Others say, well, I want personalized therapy. When would group therapy be appropriate?
That's a good question. Really, I think it makes sense for somebody to start in an individual format first and then work with somebody to determine whether group therapy would be a more appropriate route. Group therapy is typically helpful for support. It's really helpful for people to be in a room and in a group with other people who are experiencing similar issues, especially people who are feeling isolated or alienated. So I think what differentiates individual work from group therapy is kind of that support element. The work might not be as intensive in a group format.
So tell us about the social anxiety exposure group. I know a lot of people have social anxiety. Some of them don't even realize it. And I think it's such an important aspect of socialization and being successful as a human being in life that people don't put enough focus on it. They spend a lot of time on social media. Right. They spend a lot of time on other internet sites, but they don't focus on being in a community, connecting with people.
Sure. It brings up a lot of fear and anxiety and insecurity for people, beliefs about being inadequate some way or not good enough or not likable. Social anxiety exposure group is basically a principle of something called exposure therapy. When somebody is struggling with a significant fear about something, whether that's people, whether that's disapproval, whether that's a fear about dogs, whether that's a fear of success or failure, one of the ways that we effectively treat fear is through something called exposure therapy, where we expose the person to the feared stimuli. And through a process of something called habituation, it starts to lessen the fear over time. It also helps people begin to tolerate the anxiety and the distress around the anxiety that they feel when they're around people.
After the break, I want you to give me a little bit of a session of psychotherapy, because a lot of these things you're talking about I think is relevant in my life and others as well. And yeah, I'm doing fine. I'm very happy, thankfully. But there are issues that undermine a lot of my behaviors. And maybe you can help me out by asking me some questions and commenting on what my answers are, so people can understand what it's like to go through psychotherapy, even though we're just going to be limited to a few minutes. But at least I want people to understand that this is a normal process that can only help typically. Although I guess some people would say that it doesn't help if they're not all in. Do you have problems with people who are not, right now I'm willing, you can ask me anything, but what about people that put the masks up? I think we call it mauvaise foi, which is putting up a mask and not being who they are in therapy.
Yeah, I call that emotional masking, right? If that's the case, that becomes the issue, and my role then is to move through that and understand where that mask first developed and why and what it's protecting. And we talk about it and we bring it into the room, because as long as those therapy interfering behaviors are there, we can't get to what we need to. So sometimes we start at different places with different people.
Well, it makes sense, because not everyone is the same. We need to take a quick break. We're going to come back. We're going to talk a little bit about a specific issue that I might have. We're also going to talk about medications versus psychotherapy and how that fits into treatment. folks, it's really important. If you're listening today, you really want to take this seriously because it's all about making your life better. This is something that we all can use, something that we need to discover within ourselves, what it is that makes us tick and how we can be better human beings. You're listening to the Doctors Roundtable right here on Talk Radio 790 KBC. Yes, we are back. This is the Doctors Roundtable. I am Alan Gurvey, lawyer extraordinaire from the law firm of Rowan, Gurvey and Wynn. And of course, I host the Doctors Roundtable because these are important issues to me, my clients, and my life, and it should be to yours as well. Today we are having a fascinating conversation with Dr. Liana Georgoulis, who is licensed clinical psychologist and founder of Coast Psychological Services. Go to her website. It's drliana.com, DoctorLiana.com. We are talking about psychotherapy right now. Dr. Liana, a lot of people who I know have been in psychotherapy for years and years and years. And sometimes I ask them, how's it going? Why are you still in psychotherapy? And sometimes the answer is, well, I just go every week and we talk, and I almost get the impression that they're just going through the motions and it's not effective. It may be because of the psychotherapist or the psychologist, or maybe because it's the process. How do you deal with people who may not be successful at this, or how do you ensure that you're moving forward and helping people versus just getting into this kind of rut?
Sure. Well, I would like to make the distinction between supportive psychotherapy versus, true intervention stages of psychotherapy. So some people do the work and they like having the support and maintenance and tune-up sessions, and I think that's one thing. But there has to be an intervention or a treatment phase. That's what I call it. And that's really where the clinician truly helps the person understand what their patterns are, what their struggles are, the underlying themes, the core beliefs, the schemas, the coping strategies, the fears. All of these things absolutely need to be addressed, and the individual who's in therapy ideally understands what those issues are and also has a roadmap or a blueprint for how to move through those things and effectively make those changes. If someone doesn't think that they understand what the issues are, or that their therapist doesn't have a treatment plan in place, and if they're not clear what they're working on, that's problematic and that's not effective psychotherapy.
And what about therapists who are very aggressive and active in the session, whether that's good or bad? Some people want to get feedback. They want to hear a therapist tell them what to do. And then there's others who want to spend the time talking, and they hope that their therapist is going to listen and maybe add some valuable insight. But we hear it all the time that these different kind of strategies from the therapist, or maybe some of the therapists are egomaniacs who just want to use the session to talk about themselves.
Well, no, I mean, there's some truth to that, or sometimes people don't want to really do the work. It's easy to just sit back and listen, right? The art of psychotherapy is really listening and knowing what to do with that and knowing how to use that information to help someone. So what I tell my clients who tend to talk a lot is, if we can use that information and do something effective with it and understand the underlying meaning behind that, or how that relates to a schema or a coping strategy, then great. But if somebody comes in and just wants to just sort of regurgitate what they've already been thinking about all week, hours a day, and then just sort of speak at me, that's not going to be effective. That's actually going to encourage them to continue in their rumination process, which is a maladaptive coping strategy. So what I do is I set an agenda at the start of each session with my clients, and I tell them at the beginning of therapy that we collaborate on the agenda. So each week I like them to think about potential agenda items, things that come up, and I have them bring them into the session. But I also have agenda items related to my treatment plan and what I want to teach them and what we want to get to and what we want to uncover. And earlier on in therapy, I have a more directive role in setting that agenda, as I kind of have a prescription for what I think is going to be most helpful for that person. But as treatment progresses, the individual becomes more active in setting their agenda. And then we get to a place where we go, have you met your goals? Are you feeling better? And if we agree, then we might terminate, or then we might titrate down into more of a supportive therapy role.
Okay, so I'm coming into your office now, and I'm coming in for the first time, let's do some role playing here. I'm sitting in your office. Nice to be here.
Nice to meet you, Alan. How can I help you?
Well, what do I call you, Liana or Dr. Jorgulis or Dr. Liana? What should I call you?
You can call me Dr. Liana or Liana, that's fine.
Okay. So Dr. Liana, you know, I've had some anxiety lately. I haven't been sleeping that well. I'm not sure why. I mean, I seem like I'm doing fine in life. I'm happily married. I have 2 adorable kids and great kids who are young, and I'm relatively successful as a lawyer. And, you know, I have this radio show, which is kind of cool. But I just don't seem to be so fulfilled. I don't know what it is. I'm looking for more or something, and it causes anxiety. And maybe that's normal, but it's not always comfortable for me.
Okay. So the first thing I'd want to know in this situation is you're talking about 2 distinct kind of issues. One is not feeling fully fulfilled, and one is feeling anxious. So I'd want to know a little bit more about each of these things and then try and understand how they're related. So I might say something like, Alan, why don't we first start with the anxiety? You're telling me that lately you've been feeling a little bit more anxious. What exactly does that mean?
Well, I'm not sure if I'm really succeeding. I'm getting nervous about, you know, being in this life, and there's only so many years that we live, and I just feel like anxious, like am I going to accomplish everything? I don't know if my thoughts are all, you know, screwed up, or I just feel like I don't know if I'm really accomplishing anything, and maybe it's going to be too late.
Okay, so when you feel anxious and you start thinking about these things, does it feel to you like you're worrying? What if I don't make past this? Okay.
Absolutely. I mean, I get word from my family, you know, what if I can't provide for them, and what if there's problems and issues that come up? I don't know what to do.
So if you had to come up with the key themes that you tend to worry about, it sounds like success, it sounds like fulfillment, it sounds like providing for your family. What are some of the other things that you tend to worry about?
Well, I worry about not being happy, in focusing too much on my work and not spending enough time with my family, and there's an inherent conflict, and it causes me a lot of anxiety.
Okay, and when would you say you started feeling anxious about these types of things? Have you tended to worry throughout most of your life, or is this something that's been more of a recent development?
I think it's been through most of my life. I think, you know, earlier, before I had a family, before I was married, I was a little more, free thinking, and I didn't feel as much stress and pressure. But the family thing and trying to provide and all this is just, you know, it's really kind of, you know, really bothering me.
Mm-hmm. And when you find yourself worrying about these types of things, Ellen, does it feel like it's difficult to kind of turn off your mind and disengage from this worry, and does it sort of take over? And
how do you know? How do you know that? I mean, it can be at any time. I can be sleeping and I wake up and I can't get back to sleep. Sometimes I'm at work and my mind will wander and I think, am I doing everything? Should I go to my kids' t-ball practice, or should I stay and work on a client's case? How do you know that that's what I'm thinking?
So worry, even though it's something that happens in our head, is actually a coping strategy. It's a mental behavior. We call it rumination. And it's part of just the human brain and the human mind, right? The human mind has evolved over thousands of years to try to help us plan and predict and control situations. And it's good. I mean, the species have advanced to the level we've advanced because we can think through things. But there's a point at which it stops being helpful and starts to be very unproductive and very unhelpful. And so it's kind of this compulsive need to worry because you think that you're going to control the outcome of things and there's going to be no bad surprises. But what happens is worrying is a complete waste of energy because it takes us out of the present moment. It causes us to think about problems that haven't happened yet and may never happen. And it does absolutely interfere with being able to connect with what you find meaningful and valuable in the moment. So as we continue our work together, I definitely would want a better understanding of when you worry, when it gets activated, what those core themes are. And I'm going to be teaching you some different techniques and strategies to start disengaging from the rumination, knowing when you're doing it, and learning how to quiet the mind a little bit. I'd also like to teach you some effective problem-solving strategies so that if there is truly an issue that's coming up that you need to work through, there's ways that you can think about it constructively. There's ways that you can resolve the problem that might only take 10 minutes. And that's a lot different than spending 2 or 3 days walking around, ruminating, and then not feeling like you're any more clear at the end of that about how to navigate a situation.
You know, it was really hard for me to come in today to see you because I don't want to feel like, that I'm not normal, or that maybe I'm putting too much focus on this rumination and this worry and the sleeplessness. But now that I have, it's kind of opened up my thinking, and now I really want to know what I can do so that I don't get caught up in this whole rat race in life.
Yeah. So I think, worry and not being present and getting lost in our inner dialogue, what I've often called the inner terrorist that lives in our brain, it does take us out of the present moment. And that could partly be why you're not feeling fulfilled, because you're spending all of your time worrying and in this mental trap rather than fully being present and connecting with what's meaningful for you.
So there's something more to life than just worrying?
Yes, there absolutely is. Worrying is robbing you of your life. But I'd also want to know, and maybe you don't have a sense of this or not, but you mentioned that you feel unfulfilled. So I think the worrying and not fully being present is part of that. But I also want to have a better understanding of what maybe is getting in the way of you being fulfilled. What does being fulfilled look like? What does that mean to you? And one of the things, to pause for a moment, that I do in my work with my clients is something called values work, where we really take some time systematically looking at what somebody values in their life, what they want their life to be about, what's meaningful, who they want to be, what makes them feel alive, what feeds their spirit. And a lot of people don't know what that is. So back to our therapy
really
session.
Important. I hate to say it, but usually it's the therapist that says our time's up, but it's going to be the patient today saying that our time's up for this therapist session. I really am looking forward to my next therapy session with you, Dr. Liana, because you hit on some things that I need to explore, and that's that value system. What's underlying what you're seeing here today, which is the symptoms. Unfortunately, we're going to have to cut it here for my therapy session. We have to take a break. We will continue. After the break, we're going to talk to Dr. Liana. We're talking to Dr. Liana Georgoulis. I'm Alan Gurvey. You're listening to the Doctors Roundtable right here on Talk Radio 790 KBC. Wow, I'm sweating. We're here at the Doctors Roundtable. I'm Alan Gurvey, and I'm with Dr. Liana Georgoulis, who is licensed clinical psychologist and founder of Coast Psychological Services at drliana.com. And Dr. Liana just played therapy. We were role-playing. I was the patient. Dr. Liana was the therapist. And, yeah, that got me going. It made me think a lot. And for those of you who did not hear it, you really need to listen to it. We'll have the podcast, The Doctors Roundtable, will be up on KBC. So you will be able to listen to it. Go visit the Doctors Roundtable site at KBC, and you can hear all of the podcasts there. Dr. Liana, we have a few minutes left before, unfortunately, we have to end the show, but I do want to talk about what people should consider when they're looking for the right therapist. Obviously, when you were giving me therapy, I was listening, and you were really intuitive and insightful. What should people be looking for the right therapist?
Mm-hmm. Well, I think that sometimes you don't know early on if someone's the right fit for you or not until you have a couple of sessions with that person. But I think that the first step is making sure that you kind of like your therapist's personality, but that as you talk about your struggles, that they are clear with you about what the treatment plan is, what their approach is, how they're going to help you move forward. You want to make sure that that person really understands the issues, is able to kind of communicate that back to you so that it's clear, and then give you things to work on and new skills and new strategies. So we don't want someone to feel like, well, here's all of your problems and you don't know how to get out of this.
We've talked a lot today about living a more fulfilling life. I think that's what all of us really like to focus on, and sometimes we're just not that successful. What type of thought processes should we try to think about when we're talking about living life to the fullest?
Sure. I'd say there's so many different things that interfere with people's well-being, but they're all very, very common, and there's a few core themes. Fear gets in the way of living life in a truly meaningful way, and so does not being mindful or being present, and then getting lost in what I call the mental trap, which is talking with your inner roommate. This is the excessive chatter that is in your head all day long.
I mean, we all have an inner
We
roommate?
all have an
I thought I was the only one that had that.
You are not the only one. I have an inner roommate too. And I just like to, prove the point. Can you imagine if this inner roommate who's constantly talking to you, telling you, you're not going to be able to do this.
Right.
Like, life is awful. Everyone's better than you. This person doesn't like you. Why did you say that? That was stupid.
Yeah.
Can you imagine if this person was following you around all day long? You're in bed sleeping and it's saying, Alan, you should be further along in your life right now. Time's running out and you need to get with the program. So it's actually this inner dialogue that is probably the most harmful sort of factor that gets in the way of our well-being. So it's learning how to quiet the mind and disengage from this constant narrative and truly learning how to be mindful and learning how to be present. So what does that mean? Well, if people go to my website, drliana.com, there's different mindfulness techniques they can practice, and I have some articles I've written about mindful living, about valued living, and that can hopefully give a little more information. But it's learning how to pay attention at any given moment to what your inner experience is, knowing what your body is doing, knowing what emotions you're kind of carrying with you, knowing where your inner roommate is trying to take you. And it's about being careful not to get caught up in that trap. So when we're caught up in that trap, we lose the awareness that we're even in that trap.
Well, that's very true.
Right?
I know a lot of people don't even realize it. And, and I have a fear when I'm getting back into my problems. But, when I look at my kids and they're 2 and 3 years old and they're just really developing at this point, I wonder about their inner roommate.
Mm-hmm.
I wonder how that's shaping their life and what people say and how they respond. And I would love to see, when you talk about a blueprint for life, an ability for them to get control of that inner roommate before it's too late.
Yeah, and it's certainly something to teach your kids not to respond. Our thoughts are not facts. They're not accurate. Most of it's garbage, actually. Most of it's nonsense. It's not helpful. It keeps us trapped. And so it's about really learning that you are not this voice in your head, that you are, again, at the risk of sounding too hippie-ish, but you're the consciousness that's able to see that you're having these thoughts. You're the consciousness that's able to note that you're having an experience. And it's learning how to be present enough to note when these things start to wash over you, and then how to disengage from it and not react, but rather choose then to act in a valued way and not to get too caught up in this criticism and this judgment and this fear and these worries.
So what about the opposite? What if we can develop an inner roommate in our mind that is just like this wonderful, wonderful person who's telling us how great we are and how we're doing really well and not to feel insecure and how people like us? Is that something that should be a goal for all of us?
Yes, absolutely. We don't want to go about it in a narcissistic, unrealistic
That's
sort of
true. That's
way.
true.
Like I'm
Donald
the
Trump,
right.
Can I say?
You said it, I didn't. We don't want to go about it in like, I'm so fantastic and great. We want to go about it in a way that's kind, that's compassionate, and that's gentle. And self-judgment is one of the biggest things that gets in the way of people's happiness. When we judge ourselves and we judge our experiences, we absolutely stunt our ability to truly investigate and understand what's coming up for us and why.
Right.
And that's kind of the most pivotal part of growth and evolution, is first going, what's going on? What's coming up? Why am I feeling this way? Where is my mind taking me? And the more we see that, the more we can disengage from it and do something different.
And I think I saw on your website, I'm not sure, but I read something, it was an acronym about recognizing and acknowledging. What is that all about?
So there's a mindful technique that I like to teach people. It's called RAIN. This is not my own technique. I've borrowed this from Tara Brach, an amazing psychologist and mindfulness expert. And RAIN stands for recognition, acknowledgement, investigation. And then the N, I've added my own kind of interpretation. I also say what's the need in this moment, but also not overly identifying with the experience. And what this means is, first, being mindful enough to recognize what it is that you're struggling with. Is it an emotion? Is it a troublesome thought? Is it something like procrastination? Is it a craving to eat food? Is it a craving to smoke a cigarette? We have to first notice what we're feeling, what we're thinking, what we're experiencing in our body, and then we acknowledge it. Instead of trying to push that experience away or judge that experience, we just take a moment to greet it hello.
I think the best way for the folks who are listening to understand it is to contact Dr. Liana. Her phone number is 310-801-1711. That's 310-801-1711. Her website is drliana, DoctorLiana.com, drliana.com. It's Coast Psychological Services. Dr. Liana, this hour has been fascinating. Thank you for coming to the Doctors Roundtable and really enlightening so many people on psychotherapy and the issues that you deal with every day.
Thank you so much, Alan. It's been great being here.
I look forward to having you back. Again, this has been quite an enlightening experience. Psychology affects all of us. And you are listening to We're Ending This Right Now, and I Screwed Up.